infections that affect the respiratory tract system from the nose all the way to the alveoli. They are 1 in 4 of the tropical diseases that are in Africa, and because of their huge impact on vulnerable communities, the mortality and morbidity rate is very high. The purpose of our manual is to inform you guys about the transmissions and symptoms of acute respiratory tract infections, as well as to highlight the specific lifestyle of your experience. So to start team, my name is Jessica Edom.
My name is Bruna Solidetti.
My name is Diviskurti Amacherla.
My name is Amy.
My name is Caleb. My name is Jonathan.
My name is Jacob.
Okay, so some common symptoms associated with acute respiratory infections are a sore throat, nasal discharge, a cough, whether that's a wet cough from a bacterial infection or a dry cough from a viral infection, shortness of breath, fatigue, indrawing chest, which in other words means a retracting chest in attempts for the individual to get enough air, and continued fever. Some variations in symptoms for acute respiratory infections are babies that are born with a lower birth weight than average, and they could just have impairments in their immune system. So low-income households, which a lot of them live in mud brick houses, which are very humid because there might be plants growing on the walls, and individuals with COPD, asthma, and cystic fibrosis as well. And it's very important that parents know that one of the most common symptoms for infants having respiratory distress is nasal flaring, because parents should be aware in order to help their children.
So there are different severities of the upper respiratory system and lower respiratory system. They are divided into two. So the upper respiratory system for the symptoms is sneezing, coughing, runny / stuffy nose, and sore throat. That's the mild part of it. And then as it progresses, for the moderate is congestion, persistent coughing, sore throat, fatigue, and for the severe, which is actually not like too severe because the upper respiratory system is not as bad as the lower respiratory system. So it's just sore throats, violent coughing, high fever, severe nasal congestion, and severe headaches. The lower respiratory system is where most of like the life-threatening diseases are. So there's chest tightness, cough, shortness of breath, that's just the mild. And then persistent cough, trouble breathing, increased respiratory rate, and chest tightness. That is the moderate, which is actually like pretty severe when it comes to symptoms. And then the worst part is the chest pain, that should be shortness of breathing, and increased breathing, like so you would breathe a lot heavier, shortness of breath even when you're resting, and bluish staining of the lips.
Okay, so I'm going to talk about basically the main ways in which ARI spread from person to person. So for the first, most common mode of transmission is literally person to person. We're talking about contact, exchanging bodily fluids. If you're a pregnant individual, your child may be infected with an ARI if you are currently infected. The most common form of transmission when it comes to ARIs is droplet transmission. So when you sneeze, when you cough, you release droplets up to 1 meter away from an infected person, and it can infect someone else simply through contact. Unique or less common modes of transmission include airborne transmission, which is basically the same as droplet transmission. However, pathogens that you release when you cough or sneeze remain in the air for extended periods of time, and if an uninfected individual has contact with those pathogens, they may be infected as well. Contaminated objects, so if you're touching a surface that is contaminated or you're touching blood or messing around with blood, medical equipment that is contaminated, then you yourself might find yourself within ARI. So I'm basically going to be talking about environmental and ecological factors. So air quality is basically talking about how if there's a certain concentration of certain substances in the air, you're more likely to contract certain ARIs, for example, pneumonia, viral pneumonia. Certain areas face higher risks of contracting ARIs, depending on what season it is. For example, the tropic northern hemisphere, in the winter season, you're more likely to catch ARI. Air pressure during the changes of altitude during a plane ride, for example, there's a chance that you might face small injuries to your alveolus. What that might do is it gives you the chance of developing sinusitis, which is a form of ARI. Animal reservoirs, influenza in particular. If you have contact, or if a human has contact with an infected animal, an ARI may be transmitted from that animal to a human.
High-risk areas. So ARIs are more prevalent in northern and mostly northeast Nigeria, which includes the states of Yobe, Jigawa, Kano, Bauchi, Gombe, and Taraba. And there are multiple socioeconomic and demographic factors that increase susceptibility to this issue in that area, starting with food insecurity. So the food prices are very inflated, and there are multiple shortages resulting in improper nutrition. Second is the strong terrorist presence there, which results in limited healthcare access, poor air quality, and regional displacement, which results in overcrowding. And through overcrowding, there is poor ventilation, and the close proximity of individuals to each other increases the rates of transmission of ARIs. Poor living conditions. So most of northern Nigeria has houses made of mud brick houses, and not very well developed bathroom and sanitation facilities, which also may increase the risk of transmission. Educational status. So usually people who are educated are more likely to know to take preventative measures and are aware. Next, exposure to biomass fuel. So cooking with wood, which is one of the main sources used, the smoke from it can increase the chances of respiratory illness. Employment. Those who are employed are usually able to afford a better quality of life for themselves and their families. Immunization, so depending on where they live in an urban or rural area, the access and information on vaccines may be limited. An overarching reason is poverty, because based on their socioeconomic status, they need to be able to afford all these things that keep them healthy.
So focusing on the impact on health and society, as I said earlier, ARIs are extremely detrimental for vulnerable groups. About 33% of children underneath the age of 5 in developing countries pass away due to ARI infections. And when you think of this data in combination with the lack of resources, the lack of funding, sometimes the lack of transportation to clinics that can provide this care, the problem gets much bigger, much worse, and we start to realize that these communities are not able to thrive and reach their full potential.
So the healthcare system in Nigeria has a lot of diagnostic challenges. The patients wait a lot of time to get to a clinic or a hospital when they have symptoms. So those symptoms get worse, so they don't go because they don't have the transportation to go there. The clinical samplings are not good enough because they don't receive good resources from the government to get good products. And a lot of times, even physicians tend to confuse those ARIs with malaria due to the fevers, so they end up treating those patients with the wrong medication, leading up to wrong outcomes. The access to healthcare can be limited, especially to children. They don't invest too much for children, they invest much more for adults. Some socioeconomic impacts of ARIs is that because patients do not have a lot of money, they are not capable of paying for the treatments. And if they do, they have to stop paying for food or for some financial needs that they need to provide to their families. If the people get sick, they won't be able to work. And it's not only for them, their income, but like the government also needs that they have to work. If young children miss a school for the future, those will be consequences because the children are the future of the country. So if they miss a school, they won't have the education to be better. When patients get disease, they can also face discrimination, which can lead to bad health in the brain.
Community workshops. Our workshops are going to be focused on kids, and they're going to be trying to teach them the symptoms of ARIs and also how they transmit. This game will use spray bottles to show how fast ARIs can transmit to another person and how other diseases can as well. And this game is going to be approximately 3 minutes long with 6 competitors. One competitor starting off with a spray bottle, and they're going to go around and try to spray someone else. When they spray someone else, they're going to go sit down, and the person who sprayed is going to get the spray bottle and try to spray everyone else until everyone is out. The person left remaining is going to be the winner.
By a show of hands, who here has actually solved the puzzle? All right, jigsaw puzzle, yeah? Have any of you actually solved a double-sided puzzle before or seen one? No? Okay, well that's what we want to change. So on the right-hand side, you have what would be the bottom of the puzzle. So you have a list of symptoms for ARIs. Some of these concepts or some of these words, the average citizen might not know, so we took the time out to define it for you. This will be on the back, and then on the left, you can see the full image of a sick child. We picked this image because I believe personally that people will be able to relate to this image, see their neighbor, see their friend in it. Participants will be able to choose which side they want to solve with. At the end of the day, the pieces all fit the same no matter which side you are looking at. However, we do prefer that participants take the time to at least look and familiarize themselves with the symptoms, as the symptoms create the bigger picture of a sick person, which is the symbolism of the idea.
Now for the handout. So we are going to hand out coloring books for the children and families. So this is an example of what we're gonna, of one of the coloring pages that we're gonna give out. So it's, this example is an example of a person getting a sore throat. So we were planning on, after everything we do, after all the lecture we give them, and then after the game that we play, we were gonna hand these out so they can share it to their friends, share it to their classmates, so on and so forth. And then that's how kids will eventually be able to spread word about any of these symptoms that may hurt them.
And then this is the budget. We would only spend $184. There's a lot of money remaining. And the rest of the money will be donated to hospitals in the surrounding area where the workshop will be held, therefore helping them be able to get newer equipment and treat patients better. And then these are all of our resources. Now, I would like to, on behalf of my team, thank you guys as well for treating us incredibly and teaching us a lot. We've learned a lot and grown a lot this past week, and I feel like I am a better and improved version of myself.